Good afternoon, everyone. My name is Julie. I'm from the New England QIN-QIO, and I'll be your moderator for today's webinar, Session 5 of Interact, Using Data to Drive Improvement Quality Improvement Tool. The Quality Innovation Network, Quality Improvement Organization, works with healthcare providers, stakeholders, and communities across New England on data-driven quality initiatives in order to improve patient safety, engage patients and families, and improve clinical care at the community level. Thank you so much for joining us for today's webinar. Before we get started, just a few housekeeping items. This call will be recorded for training purposes. I'll be providing you the details on accessing the recording at the end of this webinar. The phone lines are going to be on mute for the duration of this presentation. We will be taking questions at the end of the presentation, and I'll provide you with instructions on how you can ask a question over the phone or pose a question in the chat box. Please make sure to send questions to all of the attendees. So at this time, I'd like to introduce Sheila Eckenrode, who is going to start us off today.
Good afternoon, and thank you for being here. We're happy that you're here. This is the 5th session in our Interact webinar series. Today we'll be talking about how to use and present aggregated data. We have guest speakers Adrienne Mihalik and Claudia Wright with us today. Just a little bit of an overview of where we are. I'm assuming most of the folks on this call today are participating with us fully and hoping to gain an Interact participation certificate at the end of these webinars.
Go back?
Yeah. Okay, we're going to go over this.
No, I thought you were telling me to go to the next slide.
Sorry, we're a little goofy here today. In order to win an Interact participation certificate, you need to attend 7 of the 9 webinars that are being offered. 2 may be viewed online. We ask that you send readmission data to us to Qualidigm for at least 4 months. That can be accomplished quite easily if you're entering data into the NNHQI Safely Reduced Hospitalizations Tracking Tool and complete the data use agreement by just checking the box. We can access your readmission data, and hopefully you've been doing that, and if not, you can begin doing it now, and if you need help doing that, that's what we're here for. And at the end of the series, we ask that you have your nursing home administrator complete the Interact Tools checklist to verify that Interact Tools have been implemented in your building. And again, it would be a rare facility that was able to implement all the Interact tools. So we don't expect a full implementation at the end of this webinar series, but just that you're pointed in that direction and moving along. Okay, if you miss a session, you're able to access the Internet webinars after each session. Also, if you want to share this information with staff members who are unable to participate on the facility's behalf, you're always welcome to go to our website to listen to the Miss section, and each facility, again, is only allowed to watch 2 online sessions. Okay, there is some information on how to access the website. I won't go over that, but this will be available for you. Interact session dates that have already been recorded, March, April, May, and June. So again, you're welcome to see that. So I'd like to take a moment now to introduce Adrienne Mihalik and Claudia Wright, our guest speakers today. They're both with the National Nursing Home Quality Campaign for Improvement. Dr. Mihalik is a senior biostatistician at Heligen, the Quality Improvement Organization, our sort of sister organization on the West Coast. She's also the program manager for the National Nursing Home Quality Campaign. Claudia Wright is the lead healthcare data analyst for the National Nursing Home Quality Improvement Campaign. Both of them are experts on the Reduce Hospitalization Readmission Tracking Tool, and we're very fortunate to have them here. We're really hearing it from the subject matter experts. So welcome, Adrienne and Claudia, and we will pass the ball over to you.
Sheila, thank you so much. And this is Adrienne for voice recognition purposes. This is Adrienne with the campaign. And I was with you in June, I think, May, June. anyhow, happy to be back with you all again. And today we're going to talk about, once you have the data entered into your workbook, you're going along, once a month, you're going to go to the campaign website, transfer your monthly aggregate data into the website, and there you also have trend graphs and the ability to set and display your target so that you can watch how close you're getting to your target. So we're going to review all of that in just a moment. Before we get to that, though, we wanted to open it for any lagging questions you have regarding using your tracking tool. Hopefully everybody's had a chance to get their feet wet. You've downloaded your tool. You've been entering some data. And we'll take a couple of questions now, and if we have a lot of questions, we'll do some more at the end. And hopefully everybody can see I've got the tracking tool open on my screen to the Admitted with Recent Discharge tab. And any questions you have, let's type them. I think that we decided let's type those into the chat box. And if we have questions, maybe one of our moderators can read those.
So if there are any questions on the line, folks can press #6 to unmute their line. Or as you mentioned, they can type their questions in chat.
So while you're thinking and typing, I'm going to go through just a couple of key points that may jog your memory about a question you've had, and if we don't, then we'll go on. And of course, you'll have a chance to formulate your questions for later on in the presentation. So on our drop-down list, we are remembering to add any new residents that come in during the month. So this looks mainly alphabetically organized, but if I had new residents, I'd be adding them to the end. Sometimes I may see something like this at any point. When you add a new resident to the end, you're going to select all of your residents, right-click, and choose Sort, A to Z, and then say Yes. And that's going to sort them alphabetically and remove spaces. And that makes removing spaces by going to Sort is important for your drop-down list to function on your Admitted with Recent Discharge tab and your transfer log. And having them alphabetical is really important to make sure that you don't have duplicate names. You don't want to have the same name listed twice or two variations of the same name in order for the workbook to be able to link up the coming and going of those residents. Easy to miss, the census tab. If you're ever not seeing your transfer rates on your monthly tab, come to your census worksheet and make sure that you've entered those in. So if I were to go to July right now, let's just take a look at this because I've had this very question this month. If I go to July, I don't have probably for several reasons, I don't have these, but it doesn't show any resident days right here. That means that I forgot to enter data on my census. So I'm going to go right back to that. If I enter the data here, this is what happens. Okay, entered it, it totaled up. I'm going to go back to my July, and because this is a demo workbook, I may not actually have other July data in, but see how these two cells are populated? So if I had also entered my transfers, I would also now have data in all of these cells as well. So that's sort of look. Now, we're going to go to the Admitted with Recent Discharge tab. And my important reminder for you here is that you're not entering all admissions. It's only those admitted with recent discharge. So they need to have had a discharge from an inpatient hospital, from an acute care hospital, within 30 days of the date they come to you. If they meet that criteria, then you'll record them here on this tab, Admitted with Recent Discharge. And your transfer log should include every resident, any resident who has an unplanned transfer to the hospital, whether they're long stay or short stay, whether they came to you from a hospital recently or not, anybody gets recorded here. Because we're looking at reducing any unnecessary transfer and making sure that any transfer that does occur is consistent with what the resident's wishes are. and appropriate for their condition. Okay, I'm not seeing any questions in the chat box. So with that, now we're going to, let's say that you've been successfully entering your data, and you've been entering data for 30 or 60 days. And so remind me, did everybody start in January, or did you start in another month?
The session, Adrian, started in March. Some facilities chose to go back to enter data from January, so people are in different places.
Okay, great. I'm going to choose something in the middle. In fact, I'll choose April. Thank you, Florence. So you've been entering data for a while. Come over and start looking at your monthly tabs. Now, you have a couple of handouts. The handout that you can make notes on right now, if you'd like to, is the one, it's primarily text, and it's called Submitting Data to the Website, something like that. So I'm going to come to April. I'm going to do two things. I'm going to check to see, we've got two dates here. This date is for my 30-day readmissions, and the 90-day readmissions actually get entered later. And you'll be prevented from entering your data on the website if you're early. So don't worry about that. But what we do want you to be really concerned about is this. If it's on or after May 31st, you may think that your April data are ready to be entered. But if your transfer log and your admitted with recent discharge tabs, if you have not recorded all of your events accurately up through May 31st, then these numbers won't be accurate. These numbers are always going to display for you once you start entering any data that's related to this month, but they won't be your final mature numbers. They won't be right until you have entered your data on your admitted with recent discharge and your transfer log up through this date. So really orient to this. And when I turn this over to Claudia and we go to the website, you'll see there's a reminder there too, so you've got both places to check. So let's say you have in fact been entering all of your data up to and through May 31st. You are ready to follow this set of instructions, and you're going to start by printing this sheet. Let's just orient to this. As I scroll down, it shows that we actually have two tables. This one has the name of the month on it. This one says numerators and denominators. It's this part right here that you are going to enter onto the website, and we're probably going to say this at least 3 times. I hope at least twice. We're going to spend about a half an hour going through the ins and outs of doing this and playing with the website and the data displays. The part where you print this out, log into the website and enter it takes you 2 to 3 minutes. It does not take very long. We're just going to make sure that everybody's comfortable with it and ask and answer questions and also look at the other fun things, okay? So it's actually a very quick thing. You print the page. So I think I can just do right click. And do I have a print here? No, but if I'm on it, I can choose print here. And I would just choose this. And then make sure that you've got your right printer. And I don't really have any printers here that are going to work for us. But make sure I have the that and it's going to print both pages. That second page, those are your numerators and denominators, and it's really useful to know that they're there because sometimes you're going to see a high transfer rate, but it will be because you have a really low denominator. And we can talk about that whenever you want, but these numerators and denominators help you interpret your rates so that you can be the expert on your data and drill down into it a little bit. But it's just these top numbers that you're going to enter. So you're going to print them off, click here, so you still have your screen up. You're going to click here, and it's going to take you to the website. And with that, I'm going to turn it over to Claudia. In fact, Claudia, maybe I should just this way it's going to look like we've got a smooth transition. You would sign in if you're not already signed in. And let me pass the ball to Claudia. And please, we love questions. And so please, by all means, chat us questions along the way as you have them. And we can jump in. I'm going to be watching the chat box while Claudia presents. And at this point, if you have printed out the slides, we sent the slides as a handout. We're not actually using slides. That's so that you have a reference to their screenshots for what Claudia will be going through. You can scribble on them with your own notes as well. So Claudia, handing it over to you.
Thank you, Adrian, and good afternoon, everyone. I am Claudia Wright, and we are currently on just a demonstration page for our campaign website, but it will look and feel exactly like the live website that you will log into from that link that was on the tool that Adrian just showed you. And so once you've got the web page pulled up, you can go to the upper right corner and click on the Sign In. And this is where you can enter your username and password and log in. Okay, so what I'll talk about first is actually transferring that data from those monthly tabs that you've printed out, transferring those and actually entering those here onto the website as you're logged in under your home's account. And as Adrian mentioned, the process of actually doing that will only take about 2 to 3 minutes, but we are going to kind of go over all the ins and outs. And so rest assured that it won't take you, very long each month to actually transfer that data that you've been collecting in your Excel workbook into the campaign website. Okay. I do want to point out, after you have signed in, if you've signed in successfully into your account, you should see up at the top right, it should say signed in as, and then it'll have your username here. And so you can see here I'm signed in as My Home 2016. And if you hover your mouse, so it's over here, and then if I hover my mouse over that area, I'll get a handy-dandy drop-down list that I can use to navigate quickly between different places on the website that homes might use frequently. You can also navigate to the different pages that we're going to be looking at today with these icons here that are across kind of the top part of the page. And so there's a couple of different ways to get to where you need to enter your data. So if you hover over this area, you have several options here. I'm going to go to the Enter My Data first so that I can transfer those rates over. And so the first thing it'll do is give you the option to select which goal you're working on. And so for this project, we are doing the hospitalizations goal. And so that's what you'll select. And now, it says enter my data, and there's a few instructions here at the top that will kind of help you, remind you what this is all about. And I know in the PowerPoint, one of the PowerPoints we mentioned that there's certain internet browsers that work better than others, but hopefully everyone's will work just fine. And you can read the instructions. There's a link to the actual tool, the actual Excel workbook, and then it kind of gives you some instructions on what you need to do here as well. So hopefully we have all the instructions either in the submitting data to the website handout that you have now, or actually on the website, or at the top of the tool. We try to cover making sure everyone has access to the instructions on how to enter the data. So the first thing you'll want to do is select a year. And so I can go and select 2017, And then you might also notice here to the right is the toggle view where you can toggle between the different stay types for the hospitalization goal. I'm just going to go ahead and leave it right now in the post-acute care stay type. And the thing that pops up immediately here at the top are very similar to what was on the monthly tab of the Excel tool, where we're kind of letting you know when the 30-day readmission rates are ready and when the 90-day readmission rates are ready to enter. And then we have...
While you're right there on that screen, that is a perfect place to show how at this time we can't enter the 90-day, even though we can enter all of the other rates for April and May, including the 30-day readmission rate, which we were just looking at on the tracking tool. You'll see that it's not possible to enter your 90-day readmission rates yet, and that's just as it should be. If you check, if you ever have that, you know, wait, why can't I enter my data yet? Check the teal and red boxes at the top, and that will confirm your suspicion that it's not time yet. And it can get confusing for all of us. Our brain can get into that about, no, wait, why can't I enter it yet? Click the keep on reading, and it's all explained there. And of course, you can write to us too. Sometimes it's helpful to talk it out.
Thanks, Adrian. And just so you'll notice here, the June 2017 30-day readmission rates will not be ready to enter until you have entered all of your events that have occurred through July 31st, 2017, which is next Monday. So once all of your events have been entered into your Excel workbook through that date, then you will be able to come into your account on the website, and then these boxes for June would be highlighted the same way you see these boxes here in the April and May columns. This blue outline with the blue highlight is an indication that that data is ready to be entered. And as Adrian mentioned, the April and May 90-day readmission rates are not formatted the same way because they're not ready to be entered. And so, in fact, if I try to click in them, it won't allow me to. So, I'm going to go ahead and enter some data, and this will correspond exactly to what you've printed out. You'll skip the first two lines because those are related to 90-day readmission rates, and those aren't quite ready yet, and I'll get to this yellow highlight in just a minute. So then the next line is the number of discharges from hospital this month, and so we'll just type something in, and then our 30-day readmission rate, resident days this month, and here we have our 3 transfer rates, our unplanned transfer rate to inpatient admission, to the ER, and to observation stay. And then once you have your data entered, you just click Submit 2017. If everything is entered correctly and accurately, you will get this pop-up box that says Success. Your data has been submitted successfully. And then we just double-check, have you entered data for each stay type? If you're entering it for the long-term care and the all, you would want to return to the data entry and go ahead and complete your data entry on the website. And so now, to address these yellow highlights, it is time to enter. It is past the allotted amount of time that we need to calculate 90-day readmission rates for the March 2017 data. And so we just have these highlighted in yellow so that as you go in, you'll remember, as I'm entering April, May, June, for all these other ones that I entered, then these previous 90-day readmission rates are going to start coming due, if you will. And so we just put the yellow highlight in here to remind you that these are ready. If you want to go look on your March monthly tab from your Excel workbook, and if you've entered all of your events through the end of March, then your 90-day readmission rates are ready to be entered. And so hopefully this yellow highlighting will just draw attention to the fact that these are ready, and as you're entering stuff for 30 days, please go back and look and see what might need to be entered for 90 days. And if you hover your mouse over it, then you'll get these pop-ups that also tell you, why is this highlighted yellow? Why does this look differently? And so then you could go ahead and enter this information as well. And then I can just go down here and make sure after you entered the data, you click submit to make sure that it gets submitted to our database and saved at the database that we have on our end. So I'm going to go ahead and return back to the data entry. Adrienne, did you have some comments?
I was just going to chime in that periodically, and luckily this happens very rarely, but we'll get a message at the help desk where someone is wondering what happened to their data that they submitted. And the only reason that happens is that somebody forgot to click that submit button. So just remember that, and I think this is par for the course. I know you all are so busy, and it's really easy for something to come up. You leave your computer. We thought that everything was entered, and in fact, you may be moving back and forth across pages. Chances are it just didn't get submitted, and luckily, it's actually coming from your workbook, and all the calculations are there. Typing in this set of numbers, as you saw, just takes a minute, and so you'll put it back in. If you suspect something else happened, absolutely let us know, because if we have a glitch on the website, we want to get that fixed post-haste. So never hesitate to let us know.
Okay, and so now I'm going to go ahead and enter some 30-day readmission rates and transfer rates for May, but I'm purposely going to help or leave a few things missing, and so you can see what happens if we don't complete everything or if we have errors. The system will generate some notes to help you. And so if we go in here and we put in the number of discharges, and then we skip the 30-day readmission rate, and we put in resident days. And maybe we didn't have any 30-day readmission rates, and we didn't have any transfers. And so we just enter the denominators and click submit, and here you'll notice a pop-up box that says, oh, wait a second, there is an error. There's one or more data entry errors. The cells that are causing the problem will be highlighted pink. You can hover your mouse over to see a hint, and then it just reminds us to always refer to your tracking tool in order to correct it. And so whatever is on your tracking tool is exactly what should be entered into these particular cells. So, and you can see they're highlighted pink with a bright red border. These are the ones that are in error, and if I hover my mouse over those, then they will tell you, what might need to be fixed. And so we can put 0 as a 30-day readmission rate. And so this is also good to note that leaving a cell blank or entering 0 are not the same thing. So if you specifically have 0 readmissions or 0 transfers, then the website is asking you to actually enter 0 in those situations. And so when you click submit, now we have success and we can return to the data entry page.
Claudia, I'm going to jump in again and just orient folks on your handout. This is and I may have misspoke before, but this is on the submitting your data to the website handout, and it's on the second page on the tips and tricks. This is the first part of what Claudia showed us was 101, and this is the advanced, understanding the difference between 0 and missing, and exactly how to enter that data and what to do if you get an error.
Yep, and so it's all there. You need to reference back to it when the call's over. And then also, I believe pointed out on that particular tips and tricks page is that this data is editable. And so if you have entered something by mistake and you said, no, this isn't really 0, you can highlight it, or you can just click the mouse in here and backspace or delete button, but you can remove what you've entered and you can correct it. And then once again, though, like Adrian mentioned, once you change anything, be sure to click the Submit Data. It says that it was successful, and as you can see, this now has been changed. And so we just wanted to point out that the past data is editable as well. Anything else on the data entry, Adrian, that you can think of? Oh, I did want to point out that after you have all of once you've entered data into the website here on our grid, if you would like to download that data, you can click on this Export Data icon in the upper right-hand corner, and it will actually export all of this data that you have entered into an Excel spreadsheet in case if you need to, manipulate it in another way or do something with it in Excel. And so, of course, I've entered data for many previous years, not just for 2017. And so it actually downloads any and all data that you have entered for your home onto the website for this goal. Anything else on that data?
Yeah. No, not at all. I was going to say two things. One is that looking at that spreadsheet is one way to check for any history you may have, even potentially before your time entering data. And another way QIO will be showing coming up when we look at the trend graph. Since we're sort of between topic areas, so I wanted to leave a chance for questions. I hope everybody can find the chat box. I sent you a message, and I haven't heard anything back yet. And, of course, the line can be opened, and I'll leave it to the professionals to tell us how to do that.
If anyone on the line has a question, again, it's #6 to unmute your line.
Well, it sounds like maybe there's not any questions right now. So if not,
I'm not seeing anything in the chat box either. I hope everybody knows how to find that. But now we are going to the slide handout, right?
Yes, that is correct. And so now after we have transferred our monthly data to the website, we may want to actually view trends. And so there's a couple of different ways you can do that. To navigate to the trend graph, you can always go back up to the handy-dandy drop-down up here and click on View My Progress. Or if you're on the Enter My Data page, you can go to your trend graph page simply by clicking this icon here, and it says View Trend Graph. And so now you can see I've changed to the View My Progress page. If you need to go back to the data entry page, just go to Enter My Data. And so hopefully that's easy for you guys to kind of navigate the website to all the different pages you might be using frequently. So now these trend graphs they work best with Internet Explorers such as Google Chrome, Firefox, or Internet Explorer version 10 or higher. And so we have just a little bit of explanation here at the beginning, and we just remind our users that the data that you see in these trend graphs is based on the data that you yourself have entered on the website on the Enter My Data page. And so if you're not seeing anything in your trend chart, make sure that you remember to actually transfer the data from your Excel workbook and enter it on the data entry web page. But once you've entered your data and successfully done that for several months, you can come to the View My Progress page. The first thing you'll want to do is select the trend measure. I'm going to go ahead and select the 30-day readmission rate. But as you see, you have access to all 5 outcome measures that are calculated in the hospitalizations tracking tool. You can also select one or more stay types that you might want to view. I'm going to go ahead and unselect these 2. And you'll notice the note that says at least one of the stay types has to be selected in order to view your trend chart. So I'm going to go ahead and leave post-acute care selected. And I'm going to go ahead and click Refresh Graph. And if you'll scroll down, you can see 30-day readmission rate, kind of gives them a description of what how that particular outcome measure is calculated. And now you can see the trend chart for the post-acute care stay type. And it is for everything I've ever entered for this particular demo home. But I am going to change the time period, and you can do that a couple of different ways. You can either use this scroll bar at the top and scroll to the right, or you can use this one and scroll right or left to set customized time periods. Or you can use these zoom buttons on the bottom. It's defaulted to all, but you can look at just year to date, just the 2017 data so far. You can look over the last year, the last 12 months basically, or you can maybe just look at the last 6 months. And if you just want the last year, but maybe you want a little bit more, so you can kind of see I've been working on this since the end of 2016. So here's where progress. Yeah. Here's where 2016 starts. And so when I put my mouse anywhere on the chart, you'll notice at the very bottom it highlights the time period. That's January 2016. And so February data point is right there. And so you can kind of do all of that. And then if you actually hover over the data point, it will tell you the exact value if you're interested in that. And then beneath, if we were to happen to put, let's see, play around with this a little, and maybe I put both long-term care and post-acute care. And anytime you make changes here in these chart option area at the top, be sure to click this refresh graph so that those changes get relayed to the actual picture below. And the long-term care is the blue, and you can see I have to click the all to go back and see that there has been data entered for that, but it was back in 2014 and 2013. But I just wanted to show the 2 different stay types on the graph at once. And then when you have your legend down here that tells you what the colors represent, if you want to take one of them off just real quick, maybe kind of look at one at a time, you can just, it's a toggle switch. You just click on this actual label and it turns it on and off on the chart itself. So that's also a quick and easy way to just view one stay type at a time on the graph. And let me check my notes and make sure how I'm doing, following what we have. Okay, so I'm going to go ahead and deselect that, and we just have the one stay type, post-acute care. And you'll notice that when only one stay type is selected, that then enables these 2 options, which are displaying a campaign-wide median trend chart, or displaying your median trend, or displaying your target line on your graph. And so I'm going to go ahead and click yes to the campaign-wide median. And this, you can also click on the what is this, and it'll pull up a document that tells more about what this particular trend is. Just keep in mind it's not necessarily representative of all homes in the country or anything like that. It's only determined from nursing homes that have chosen to work on the hospitalization goal and enter their monthly data on the campaign website. So it's just any and everyone that has entered data for this particular goal into our webpage, data entry webpage. And so then we're going to click refresh graph. And I'm going to go ahead and change the time frame so it looks a little better for 1 year. And so you can see here that the dotted line is the campaign-wide. So for all homes that have chosen to work on this goal and enter their data on the website, that's the trend line for them for 30-day readmission rate for post-acute care. And then your particular line is still the solid red line. And so you can kind of see how you're doing in relation maybe to other homes that have chosen to work on this goal. And then you can also choose to, if you yourself set a target, you can choose to display the target line. And so right quick, I'm going to go up to the top, and you say, well, I haven't set a target. Well, it's real easy to do so. You just click on the set goal target. It looks like a bullet, or a target for shooting. And it'll take you to the set goal targets page. Has a few instructions at the top. You can choose between the different stay types. I'm just going to leave it on post-acute care. And I'm just going to focus right now on the 30-day readmission rate. And I'll use an example of the 15% or 15 as my target rate. And then that's all you have to enter. You don't have to enter all of them. You can pick and choose which kind of targets you want to enter or not enter, but be sure to click submit at the bottom. And it'll say success. You've submitted the data. So if I return to target entry, you can see now that this post-acute care 30-day readmission rate now has a target of 15. It was set July of 2017. The baseline data is the most recent data that's been entered as of the July 2017 date, which was the 8.4. And then as you get further and further from this month, from July of 2017, then the most recent will change. And so you could come to your target page and quickly see from baseline to a remeasurement, if you will, maybe 12 months later, what's the percent change in my scores. But once you have this target set, it will speak to the View Trend Graph page. And so therefore, if I want to go to my 30-day readmission rate, just for post-acute care, and I want to view the campaign-wide median, and also my target on my graph, then you can see the black dotted line is the 15. And so you can see where we are and where the solid line is your home, the red dash is the other homes that are participating in the campaign for this particular goal, and then the black line is your specific target rate.
I'm thinking you need to set a more aggressive target there. Challenge yourself a little bit, Ms. Claudia.
Me too. Yeah. So I think that's about it. I did want to point out that if you maybe want to, you get your graph all set up how you like it, and you're needing to present it at a presentation or send it to a board of directors or your supervisor, we do have these buttons here at the bottom where you can save this particular image either as a PNG or a JPEG, a PDF, or you can click the print and print it directly out. But for example, if I click on the PDF, it'll probably take a minute, but it'll come up and it'll allow me to save it wherever as a PDF, and it'll be the image of my graph. I say it will. So it's not working right now. But that's okay. You get the idea. So I've talked about the clickable legends, the customizable time periods, you're able to export, and then I just also wanted to mention This is a neat little button right here if you need to scroll to the top real quickly, because this is where you can go to your drop-down list to navigate between either entering your data, setting your goal targets, viewing your progress. Those are the 3 pages that I've gone to so far in this demo. You can access them there, or you can go back and forth between those pages with these icons that are at the top of all the pages. What do you think? Anything else that I may have missed, Adrienne?
I think you are doing an amazing job. And let's see if we have any questions in general. And then we do have a question in the chat box about going back and completing missing data. So let's check on the line to see if we have any voice questions about this where we're at right now.
Again,
And if not, I'm going to queue on.
Sorry, I just wanted to remind people that it's #6 to unmute their lines.
Yeah, while we're waiting for questions to come in, Claudia, I'm wondering if you could go back to the trend graph and show us a piece of trend graph where we have missing data in the trend graph so we can see what that looks like.
Sure. Let's see here. Oh.
Okay, so that's a perfect. Mm-hmm. So here's the question we have. So Miss Ann has had some turnover and wants to go back and complete. What we're seeing right now is missing data early in 2016, but it's late in 2015. But in her case, there's some missing data in 2017, and on your graph, it would appear like this, where you just have a break in your line. When you have a solid line with contiguous dots and there's no break in it, that means that data is being entered every month. In this case, what we're seeing between July and October of 2015, there's no line there at all. That means no data were entered. So if you have a place like that in 2017 and you want to fill it in so that you've got consistent data entry, the first question was, can you do that? And the answer is, yes, you can. And there's 2 things to know about that. One is, maybe your workbook had been completed all along and somebody just forgot to submit the data on the website. So, Claudia, can you take us back and show us how we would submit data, even though it looks like, and the reason I want to look at this is, visually it looks like the cells may be protected and you can't edit or enter data that hadn't previously been entered, and you actually can. So Claudia's going to show us what that looks like now. Perfect. And then we're going to go take a look at the workbook.
And I'll just point out that these that are highlighted with the blue are obviously missing and are ready. It's past the time to make sure you have mature data. And so these are showing up as missing a break in the line, the trend graph that we just showed. But I also want to show you, if you'll take a look at April, every single cell has NA. And so that one also basically is missing for the entire month. And so that's where Adrienne, I think, was saying that it might look like it's not editable, but you can click in those cells and just backspace, delete, and go ahead and enter the data that needs to be entered if your Excel workbook is actually up to date. And so I think that's maybe where you were going next, Adrienne.
Correct. So Claudia, if you wouldn't mind, because there's more to this question that we're going to need to talk about, we're going to have some actual live chat, but if you could pass the screen to me, just because sometimes the visual is helpful. Okay. So part of the question was, So I've been entering data on, let's pretend I'm down here. In fact, I do have some really funny data because I've come back and forth. So I'm entering data, and I'm in May, and I realized that January wasn't entered. Can I enter the data? And the answer is yes. The workbook is going to use those dates and sort it out so that when you go and look at your January data, once you have all of your January data in there, even if it comes after your May data or after your June data, it's going to sort it out, and you will have correct January dates. Now, having said that, Anne, I'm wondering if you can, looking at this workbook, if you can show me where you have that question about the rates maybe being different than what you were expecting. And it's *6 to unmute your line. And I appreciate this, if you're comfortable asking the question, and I appreciate it because it'll give us a chance just to talk about the rates you're seeing and how to interpret them. Regardless of whether or not this is, for the rest of you, regardless of whether or not this is your particular situation, talking about how the rates on the monthly tabs are calculated and how to check those that will be useful for everybody, I think. No? Okay, well, I'm gonna hazard, so part of the question had to do with if the monthly rates were looking higher than expected after entering data, and that's a great point. This is something that will happen periodically as you continue to enter data. Your rates may seem to increase, and in fact, they will increase. And what you're seeing, if your data on a particular month changes, it will be because you entered more data that was applicable. In other words, the data weren't complete when you had looked at them before. Again, even if we're past, in this case, this is April, so if we're past May 31st, if I continue to enter data, if I happen to enter any data that would affect these rates, the rates will change. If you're missing data, the rates may change. You can always go back and check. If you see that something changed, you can correct that on the website as well. Another reason why people will think that the rates are higher than they should be, you want to go down here and look at these actual numbers. And then you can go to it's typically the admitted with recent discharge tab that you want to look at. And the reason is this. Often when we look at this, and I realize that we probably need to switch over to wrap up just momentarily, but let me go to this quickly. You may go through and one by one be able to identify, yes, this was a readmission, so all the pink ones, right, are highlighted as 30-day readmissions. You may verify those, but it may still look like your rates are too high in a particular month. And the reason is this, and this isn't a good example right here, actually maybe. So let's say Ms. Brownlee, I see this here, I see that she's a 30-day readmission. I know that she's a 30-day readmission, but my January readmission rates are looking too high. And the reason is that what I'm thinking about is that she was actually, her return to acute actually happened on February 19th. And so I am thinking that her readmission should show up in February because she returned on February 19th. But the way readmission rates are calculated, so that we've correctly identified the 30-day readmission, and we all agree on that. And what's happening is that while it makes sense to think of that readmission as occurring because the return occurred in February, it actually is going to get counted in the month the resident was discharged from the hospital. Okay, for the 30-day readmissions. So it's going to count in January. And a way to think about that is, because we're all really focused on care transitions, and especially the transition that occurs when the resident is transferred from hospital to your home, and making sure that they were transferred at the right time of day, that you got all the information you needed, that it was appropriate to transfer to you based on your capabilities, and that you had the staff in place to appropriately receive that resident, and so on, and you continue to watch for those. This is we call it the index stay, but this is the first hospital stay for this possible return, and so this is where we're going to count it, in the month that initiated that loop that creates the readmission event. Okay? Okay, Claudia. Any last comments from you, or time to pass it back to Claudia?
Just once you've done all of this work collecting all the data in the workbook, don't forget it just takes a couple of minutes to transfer it to the website and enter it in there so that you'll be able to share it with Qualidine.
In Qualidine, I am struggling getting my WebEx. Oh, there we go. I couldn't get to the screen that was letting me pass it back to you. I apologize.
That's okay. It looks perfect. And I'm going to share our, where'd it go? Oh, wait, it looks like, Emily or Jennifer, are you guys on the line? It looks like you guys got past the ball.
I got it.
Well, since we're having a little bit of technical difficulties right now, we did want to open up the line for some questions, right, Sheila?
Yes, thank you, Morgan. Does anyone have any questions for Adrian? And Adrian and Claudia, thank you so much for that presentation. We appreciate your expertise and you're taking the time to walk us through this. If you have any specific questions for Adrian or Claudia, please feel free to speak them out or put them in chat, or if you have general questions about the Interact and this program and this webinar series, this will be a good time to ask them.
And to ask your questions over the phone, press #6 on your phone. Hi, it's Florence, and while we're waiting for questions, I just want to quickly talk about the quality improvement tool that actually accompanies your 30-day or your hospitalization tracking tool. If you go onto the Interact website, you'll be able to download this particular tool to review all your transfers to the hospital, whether they were admitted or not. You want to track where your residents are going, why they're sent out, who's sending them out, and the reasons that they're being sent out. At the end of the process, you may decide that this transfer was absolutely needed, but all of your reviews should not result in this transfer was needed. And even if that were the case, you still need to go back and look at, was there anything that we could have done earlier on to mitigate this transfer occurring? I know we're short on time, but I want to give you a real quick example of this. So we have a facility down south of us that had a resident be transferred to the hospital. They did their root cause analysis using the quality improvement tool, determined that the resident clinically should have gone out. So the quality assurance person brought this back to their medical director and said, something's troubling about this. Can you review this for me again? The medical director went back and looked at all the notes and all the data and said, yes, the transfer was needed at the time that it occurred, but he was having silent little changes that we were documenting, but we weren't really looking at those and saying, okay, at this juncture, can we do something that could have prevented that readmission? So
as you do this root cause analysis, please use your fine-tooth comb to really drill down. This is you looking at yourself and saying, could we have done something different for our residents?
Yeah, thank you, Florence. And we will go over the quality improvement tool and root cause analysis at a later time. We ran out of time this session, but I agree with Florence. It's so important. I remember a facility looking at a root cause analysis and realizing that the day that they had sent 2 residents out, the shift before them was totally comprised of folks. There wasn't one consistent staff member. So things like that you can kind of flesh out. But I thank you very much for your time. I thank Adrian and Claudia again. Please reach out to us because this stuff is fairly complicated. So just give us a call, give us a shout, give us a email. We're happy to walk you through it. Florence has the ability to share screens and get you on that website and get you up and going. So thank you. I'm going to pass this over to Julie, and she's going to close out the session. I realize how valuable your time is, and I thank you for sharing it with us.
It's been a great discussion, everyone. Thank you. I have a few announcements before we end today's call. A reminder that we are now on social media. Visit us on Facebook, LinkedIn, and YouTube. When we close out of this webinar, the evaluation will automatically pop up on your computer. If you can fill that out, please, we greatly appreciate it. If you don't have time to fill out the evaluation right now, or you're currently sharing your computer with someone, you'll receive an email tomorrow with a link to the evaluation, as well as a link to the event page on our website. PowerPoint presentation was in your data details email and will be posted on the website within the next 2 business days. Then a recording of the transcript of this webinar will also be added. Thank you so much again for attending, and have a wonderful day.
Bye, everyone. Thank you.
Bye.
Bye. Thank you.
Bye, Adrian. Claudia, thank you.
Bye, everyone.
The meeting has disconnected. The conference will be terminated in 5 minutes.